Hello, and welcome to the Colorado Hospital's Substance Exposed Newborn, or CHOSEN, Collaborative's training video for the Eat, Sleep, Console assessment tool, known as ESC tool for short. The ESC tool was developed by our pediatric colleagues at Yale, Dartmouth, and Boston Medical Center for the clinical assessment of opioid-exposed newborns exhibiting withdrawal symptoms. The ESC tool has been shown to decrease the utilization of postnatal opioids and length of stay, and more importantly, supports keeping mothers and babies together. The ESC Care tool has been adopted from Yale and Dartmouth by the CHOSEN Collaborative and implemented at delivery hospitals across the state of Colorado and the Rocky Mountain region. The ESC tool is comprised of 3 questions that assess key components of normal newborn behavior. These components are how well the infant is eating, how well the infant is sleeping, and if the infant can be consoled within a reasonable amount of time. We will go through each component in more detail. Before we begin a description of each behavioral component, let's review some general considerations when using the ESC assessment tool. When an infant has been identified as opioid exposed, ESC assessments shall begin 2 to 4 hours after birth and ideally occur after feedings. Assessments may take place while an infant is being held skin to skin or held swaddled by their mother or other caregiver. ESC assessments should continue after each feeding or every 3 to 4 hours for a minimum of 96 hours for buprenorphine and methadone-exposed infants and 48 hours for shorter-acting opioid exposures. Assessments should reflect newborn behaviors over the entire 3 to 4 hour interval since the last assessment. It is important to review and reinforce non-pharmacologic interventions that have been implemented since the last assessment. Key non-pharmacologic interventions include parent and/or caregiver presence, keeping the room lights dim, limiting visitors, and keeping external noise to a minimum, swaddling the infant or holding skin to skin, use of a swing or vibrating infant seat, and breast or bottle feeding on an ad-lib demand basis. Now let's review the key components of the assessment tool. Eating. Does the infant exhibit poor eating due to neonatal abstinence syndrome? Yes or no? Adequate feeding depends on the gestational age of the infant. An infant who is eating well is breastfeeding with an effective latch 8 to 12 times per day, or formula feeding adequate volumes for their age when exhibiting hunger cues. Poor eating due to neonatal abstinence syndrome is defined as when the infant is unable to coordinate feeding within 10 minutes of showing hunger and/or is unable to sustain feeding for 10 minutes at breast or with 10 cc's of finger or bottle feeding due to neonatal abstinence syndrome symptoms such as fussiness, tremors, and uncoordinated or excessive suck. Do not indicate yes for poor eating if it is clear that it is not due to neonatal abstinence syndrome symptoms, such as in premature infants, transitional sleepiness or spittiness in the first 24 hours of life. If it is not clear if poor eating is due to neonatal abstinence syndrome, indicate yes and continue to monitor infant. Moving on to the next component, sleeping. Does the infant sleep less than 1 hour due to neonatal abstinence syndrome symptoms? Yes or no? Poor sleep is defined as when an infant is unable to sleep for more than 1 hour after feeding due to neonatal abstinence syndrome symptoms such as fussiness, restlessness, increased startle, and tremors. Do not indicate yes for poor sleep if sleep is less than 1 hour due to non-neonatal abstinence syndrome-related factors, such as cluster feeding and interruptions for routine newborn screenings. If it is unclear if poor sleep is related to neonatal abstinence syndrome, indicate yes and continue to monitor the infant closely. Finally, the last component of the ESC tool, consoling. Is the infant unable to console within 10 minutes due to neonatal abstinence syndrome? Yes or no? This is defined as when an infant is unable to be consoled within 10 minutes by a caregiver effectively providing recommended consoling support interventions. Do not indicate yes if inconsolability may be due to factors not associated with neonatal abstinence syndrome symptoms, such as in cases of hunger, difficulty feeding, and circumcision pain. If it is unclear, indicate yes and continue to monitor infant. It is important that caregivers are knowledgeable of consoling support interventions. Examples of interventions may include talking softly and slowly to the infant, looking for hand-to-mouth movements and facilitating by gently bringing the infant's hand to mouth, talking to the infant and placing a caregiver's hand gently on infant's abdomen, bringing baby's arms and legs to center of body, picking up the infant, holding skin to skin or swaddled in blanket, and gently rocking or swaying the infant, offering a finger or pacifier for the infant to suck, or a feeding if the infant is showing hunger cues. It is important to indicate the level of soothing support needed to console an infant. 1. Little support, an infant who consistently soothes. 2. Some support, an infant who soothes with rocking, swaying, skin-to-skin contact, or sucking on a finger or pacifier. 3. Much support, or does not soothe in 10 minutes. The infant has great difficulty responding to all caregiver efforts to help the infant stop crying, or does not soothe within 10 minutes. The infant never self-soothes. Once an infant has been assessed and has received a yes for any ESC item or requires much soothing support, perform a team huddle with the mother or caregiver and the nurse to determine non-pharmacologic interventions that can be optimized further and indicate these interventions on the assessment tool. If an infant's assessment continues to include a yes for any ESC item, or a 3 for soothing support despite optimal non-pharmacologic care, and the symptoms are felt to be due to neonatal abstinence syndrome and no other etiologies, perform a full team huddle with the mother or caregiver, the nurse, the infant provider, and/or the social worker, as needed, to determine if medication treatment is needed. This training video has been produced by the Chosen Collaborative in an effort to increase consistency in implementation of best practice in the identification of and response to newborns prenatally exposed to substances throughout the Rocky Mountain region. For more information about the quality improvement efforts of the Chosen Collaborative, visit chosencollaborative.org.